We're live. Hello, everyone. Dan Harrison, President and CEO, coming to you today. And Dan, just off the screen is Dan Lannon. If you want to scoot down, I'll move over because we want to maintain 6 feet of separation.
Hello, everyone.
One of Dan's last comments to me before we went live on this is that people are just stressed out right now. And I said, oh, really? Because I am very aware of the level of stress that is that's on all of our shoulders, and we all have all kinds of things that we're trying to deal with. And the reason that we're holding today's family and stakeholder and staff, I guess there's some staff online with us, kind of summit, virtual summit, is because I want to keep the lines of communications open, because even in situations where we don't have answers just yet, and a lot of this, I'm going to be honest, we're figuring out as we go along, by talking about it, sometimes we can alleviate some of our concerns. And I hope that by hearing from me, from Dan Lannon and others, Sharon Pitts may be joining us, although she's running around doing some other things. We hope that we can continue to convey our deep commitment to ensuring that we're keeping people safe and healthy, and in doing so in accordance with the highest standards that NuPath has set. I want to thank all of you who've registered. Kevin tells me that we have well over 100 people that had registered and that are and there's 50 on right now. So there's 50 of you that are interested in hearing kind of where things are. Again, I'm going to say this, and probably you'll hear me say it again through the course of the next 60 minutes, is that we do not have the answers to everything. And there are many questions that our staff have. We hosted a virtual kind of town hall yesterday for our employees, and there are concerns about their safety if people test positive, if we have staff that are called upon to care for people that are ill. Staff are concerned about their salaries and how we're going to continue to manage to pay people. And it wouldn't be truthful if I said that we had a plan for all of that. We are again, I'll say, taking it a day at a time. Earlier this morning, I was part of a statewide conference call through EOHHS to talk about the guidance for what they refer to as congregate care settings. This is a wide term that refers to day programs, day habs, in addition to earlier intervention, children and adolescents, and so it's a wide berth of providers that are serving different populations. And I will tell you that the concerns that you're facing probably and that we're facing here on our end are not unique. That's the one thing that we can say about this COVID-19 and the impact it's having is it's spread uniformly across all sectors of industry. The difference for us is that we are in the class of essential and critical staff, because our staff are caring for people and people's lives, and we don't have the luxury of working from home. And so we are trying to balance the needs, the health and safety needs of our staff that are worried, and rightfully so, about coming in contact with the virus, against the demands of requiring them to come in to report for their shifts and to work sometimes in some settings with people that maybe have been exposed one way or another. Before we go any further, I'm trying to make it a part of my routine to say that we currently do not have any confirmed cases of the COVID-19 virus within any of our programs. We did have 2 of our folks that live in our residential programs that had temperatures yesterday, and so that's a situation that we're very carefully monitoring. and we are in contact with the Department of Public Health. Sharon Pitts, who many of you may know, who is our Vice President of Healthcare, has been physically at programs. She has been in contact with the staff, with the teams, and we're watching it very carefully. Some of your questions had to do with where will people be, where will they convalesce if they come down with the flu, and these two different cases where people had the higher temperatures were in two different residential homes. So one of the strategies that some organizations are considering are identifying one home to be, sort of like, the convalescent home, where people that maybe have been diagnosed with the virus would be moved there, but that would mean moving those people out of there and putting them into a strange home. And so the ripples of decisions that we have to make go far and wide. And so we are trying to consider all of the options that are on the table. In some cases, it feels like there's not very many options. Which is sometimes a frustration. But we just ask that that you be patient with us. This is not something that any of us have been through before, and in some cases we are learning that decisions we make have implications that go beyond what we might have expected. The other thing I'm going to say before I turn it over to Dan to give some updates around some of the sort of granular stuff before then we come back to your question is that we got some feedback after our town hall yesterday when people were talking about that maybe my affect seemed maybe that I was worried and wanting to not give that impression. I'm not worried about the virus in the sense that I don't think that we don't have the resources and the talent and the desire and the dedication to do whatever it takes. I'm more worried about some of the. I'm just going to be honest here. I'm more worried about some of the implications to our business model and to how we can continue to support the needs of so many and of all of our employees during this situation that, like many other industries, we've been impacted and financially it's a big concern. It's my job to think about these things, so I do, but people need to be aware that when we made the decision to close our day programs in congregate settings, we did so with the health and safety of people in mind, but at our own peril, because we lose approximately $45,000 a day for lack of revenue. And why does that matter? Well, because that translates to $225,000 a week that we're closed, and suddenly cash flow becomes a huge issue. And I need to be thinking about many things, like making our payroll and some of these other things. So I want to say that if I don't see my typical jolly self, it's not because that I'm worried that we're not going to be able to manage through this. It's just that I've got a lot on my mind and trying to balance a lot of different factors. But for the people on this call right now, I'm sure you don't. Those are not your primary concerns. They'll continue to be mine, and we want to talk about what can we do to meet the needs of the people in our care, and to answer some questions that you may have about some confusion or ways that we can improve during the next upcoming weeks that we may be in this holding pattern. One of the things we've been trying to do is to be very creative about how we deploy staff, making sure that we have familiar staff and that we don't incur additional costs that we might if we're using outside relief agencies and paying overtime. We have all these staff that are don't have their basic routine responsibilities during the day because most of the folks are not coming in. And so Dan Land has been working diligently with the teams to try to find ways to deploy these staff and to use them creatively to cover our residential sites. And so, Dan, do you want to do just a brief update, and then we'll go to the questions?
Sure. So, again, good afternoon, everyone. So, as you know, as everyone knows from watching news and news reports and hearing updates, it's certainly a fluid situation. And in my 20+ years of being with NuPath, it's the most probably fluid situation I've dealt with here at NuPath. What we really tried to do is when we first started planning for this, sometime, I guess it was at the beginning of next week, the beginning of last week or the week prior, is we really tried to put in, a tiered system of approaches to it so that we would be able to address, what we considered to be infrastructural and emergency needs and make sure we had some basic, not basic, but very important things to continue operations and keep continuity of services. And so what we did is we certainly ordered ahead on a number of supplies and reached out to some pharmacies, got long-term prescriptions for some of the people at the residential programs. We also tried to really educate our staff on what our approach was going to be as far as what we would need them to do to help out and pitch in. We really wanted to focus on our priority that we really had was not relying on outside temporary staffing, as Dan mentioned, which, as you know, in this field is rampant. And what I mean by that is temporary staff from an agency we can call. We have a vacancy, we can call that staff. They send us someone who's been vetted through their system, and they work a shift. Not familiar with our population. Well, familiar with that population, but not familiar with each individual person like a seasoned staff. And so we really wanted to avoid using Swift or using any of those. And I'm happy to report we've only had one shift that we've had to use that Swift staffing, and that was scheduled prior to Sunday. And so that person worked Sunday, but that was the last Swift staff that we've used. We have used our internal relief list, which are employees of NuPath who are on our relief list, our regular residential staff, as you guys are familiar with at the houses. And then we've had a lot of support from our day staff. And it's a unique dynamic with the day staff because they're not familiar with necessarily all the individuals at the house, because we do have 3 particular day programs. So we're trying to match people's specialties to houses that could really benefit from them doing some shifts and interacting. And we've also tried to ramp up additional staffing during the days at these locations so that people can get outside a little more, so that there are some more activities going on at the houses. Because I do think, depends what report you listen to. I don't know if 2 weeks is in my mind an end date to this. I think it certainly could go on longer, and that's what we're planning for it to possibly go on longer. And so we need these day staff, if not called on today, to be available next week when we start rotating staff around and start really needing to maximize all staff efforts. And it's a different dynamic. We have to deal with the union, which for NuPath is still fairly new. It's a couple of years old, and so these day service staff work in the day services. That's their schedule. So to convince them or to ask them to help us to do a 3 to 11 or an overnight has been a little bit of a challenge. But we're happy to report that we have all shifts covered to the end of March with all NuPath staff, all internal NuPath staff, and we're working on April's coverage. And so we were very excited about that. We were on the call, as Dan mentioned, with the Executive Office of Health and Human Services earlier today. We had a call with our regional DDS yesterday, and we are hearing from a lot of other providers that they're asking DDS to waive FORI and fingerprinting for them during this time, so that they can reach out and hire staff from other agencies so that they can help fill shifts. And luckily right now we haven't had to do that, and nor do I think that's in the best interest of the population we serve. And if we ever had to do anything like that, I think we would have a discussion with everyone first. But I felt felt not comfortable, but I felt, I felt proud that we were able to fill, all the shifts in March with internal staff, and people have really stepped up. And so now, as I talked about the tiered approach, those were our first two tiers, and the next would be really enhancing the activities and the programming that is happening in the house. I think this can happen a little easier in some houses because the group that is out there is very familiar with the people, but we have seen with everyone being a little stressed and nervous and consumed by any news report that's coming out, we have seen dips in activities that we'd like to see. And so met with a group of directors and managers yesterday from the residential as well as day services, and we put a couple of people in charge who are developing some YouTube videos for individuals to watch and interact. We're also going to do some sort of live updates of maybe morning meetings and different community excursion activities, or we're trying to just try anything right now, and so we've really pinpointed three people in mind that are going to lead that charge for us all, because any activity that they build or any idea that they have, they then can make sure they get the supplies, and then we can get that out to the residential programs. And we've also started rotating in some of the residential programs to activities in the day program, so that they can go out, do an activity, come here for lunch, if their regular lunch spot is not open, and just sort of be seen by the nurse if necessary, if the nurse isn't able to get out to that house that day. Again, those are smaller groups. We're doing it, we're rotating those through so each house can have that experience. So the more we could, and I know we haven't to the degree we would like, but the message to staff and it's our continued message is to get out in the community, especially on these days that are going to be beautiful, and weather is perfect, and really make sure we are keeping everyone occupied and trying to do some enriching program, because although the behaviors possibly or situations might not have arisen to where it's a challenge right now in the residential program with any behaviors or whatnot, I think over time people will get a little stir crazy, and that's when we'll really start to wish we jumped on that earlier. As far as nursing, Sharon, as Dan mentioned, Vice President of Healthcare Services, we have a team of 7 nurses that work for NuPath full time, and then we have some part-time nurses, and so she is certainly deploying them to different locations as needed to help, to educate staff, alleviate the stress of some of the things that they're just not sure for, help build some healthcare routines. And we're talking about the next layer of that, and I think there was a question that came in about things that they would go maybe to their regular doctors for, but nursing care could provide. And so Sharon has been reaching out with doctors just to get that approval for this period of time. And so any appointments we've had, at least from what I was told yesterday, outside doctors have canceled or asked us to reschedule. And so at this point, I'm not aware of any outside doctor's appointments that we will be bringing an individual to. And I think if we are, my message was to make sure that we connect with you guys to make sure that is still something you want us to do. We did hear from DDS yesterday, and I know that a lot of you received this communication, that they are asking families not to visit the group homes, and I know that has caused a level of stress and anxiety with parents. Our hope was to keep that open during this time. I think that certainly helps a lot of individuals and eases their minds to be able to see their familiar face and their loved ones. And but DDS really did invoke that rule with us yesterday, and we're waiting on sort of a written guidance to that, but that definitely was their guidance as of yesterday with the region and the commissioner. We also, if someone does take their son or daughter home, or the loved one, that if you do take them home, that we don't have a time frame of how long that time frame before they can return. And so again, those are two things that DDS sort of invoked yesterday that we're trying to get more clarification from. because I think that definitely not being able to communicate a timeline to you guys is not something I would be comfortable with as a parent, and I know a lot of you had many questions on that we're trying to flush out, and we will pass on that information as it comes available to us. So,
can I just jump in there?
Sure.
So some of you know that about a year ago I moved my mother here from Indiana and into an assisted living residence here in Woburn. And they announced at the end of last week that there was going to be no more family or visitation. Now I don't say I was outraged, because I probably wasn't really outraged, but I was really startled that was the case. And I go over to see my mother virtually every single night of the week, and I do her laundry, and I do so many things for her. And I thought, what's your quality of life going to be like without me being there? And so I've been having to take things to the door and wait for the staff to come and grab them. And I haven't made a big fuss about it, even though I felt like I wanted to initially, because I understand that the reason they're doing that, in part because it's come to them as guidance and maybe even mandated policy, that I know they're trying to protect my mother from getting sick. And if my mother gets sick, then she could die. So all of this that is being done and being asked of us, and that we're communicating to people, is to try to limit the spread of the virus. We know that intellectually, but by not having a steady stream of people coming in and out of the group homes, the hope is that we'll be able to reduce the transmission within the home. And we're just all of us with different frustrations and fears and worries, and we get it. I understand why this could be a major imposition or a major fear that families would have, and we want to be sensitive to that. We want to do whatever we can to provide you access, but at the end of the day, it comes back to, what can we do? What sacrifices can we make today to make sure this is something that moves out of here within a matter of weeks, not months? And I think that if we're more diligent now and take more distinct actions now, that we may be able to. The hope is, anyway, that we'll be able to see this move through. So the state was pretty clear about people taking their loved ones home. That if somebody is home and then wants to return their child, they've been really resistant to let that happen. And again, it's because we can only control what we have within our organization, and the worry is that that people might be gone out, they may not be observing the social distancing. We don't know. We don't think that, but that if somebody's coming back, then that maybe has been been around somebody else that's been ill or out in the community and not even being aware that they've been exposed to it, coming back and getting others in the home ill or getting staff ill. So this is just part of the greater, we know it's sacrifice for people to be making, but many of us are in the same boat, and we get it, and I understand the frustration that families must be feeling, and we're going to do everything we can to try to respond and to try to do what we need to do. A lot of the questions that we're going to try to get to in a minute, some of them had to do with nail and foot care, and these are things that they're things that you get done or that are accomplished outside the home. It's going to be up to us to figure out how to get it inside the home, and to hire people to go in if need be, and other health workers, that if we don't have it on staff, that we get it on staff, and we'll tackle these things one at a time. And Dan's already talked about some of the significant things that he's been doing to make sure that people aren't forced to stay in the house. That's not what this is about. It's about not being in crowds and being out and exposing other people. But as the nicer weather comes, there's no reason why somebody said that somebody had been in the home for 4 days straight. That's not what we're advocating. And I know Dan's taken great measures to try to create new systems in place to make sure that that doesn't happen. I think a lot of what we're doing here is kind of a triage. It's the first thing. The fact that you were able to fill all of the shifts through the end of March. Do you know how incredible that is? I mean, that in itself is a major undertaking. And so now that that's kind of buttoned up, we can move into some additional things. So I don't know if I interrupted you, but I was just thinking about it from the point of view that many of us are finding ourselves quarantined or not able to access loved ones.
Yeah, and let me just, filling the staff positions, that certainly wasn't me. That certainly was the team of Doreen and Michelle and Elder who works as our stabilization director, helping to prioritize that and to plan that and to start working on that again, as last week. And I think that's huge. That just speaks to our staff and the level of people and the quality of staff that we have here at NuPath. And this field doesn't pay tremendous. We know that, and we try to treat our staff well as far as benefits and staff and pay, and hopefully that helps us retain these quality staff that have really gone above and beyond. Right now, they're not perfect. We are not perfect. We're dealing with, as I said, a fluid situation to where we're trying to assure health and safety, first, and build off of that. I also should mention that all staff coming into every shift, they do have a temperature check. We are logging that and tracking that. We also are doing regular checks throughout the day. The nurses are at the houses as well as the MAP certified staff as far as temperatures. We also, the questionnaires, just like everybody, I'm sure has experienced at this point, we've had staff fill out the questionnaires, and any new staff coming on shift that anything changes in their questionnaires, they have to alert us. And if the staff hasn't filled one out, they are not able to punch in and do their shift until they fill that out. So we have some safeguards built in for that, and again, we'll just, my dream would be that we're overreacting and we have too much staff and we put too much emphasis on having this go longer than 2 weeks, but we can't take the chance. And what we heard on the couple of the providers' calls was I'll use the word hysteria and the cry for help by some providers. I don't feel we're there yet. We might get there sometime, but I don't think we're.
I'm crying out for help, just in my sleep, or lack thereof.
All right. So I don't know how you want to open this up.
Yeah. So I think that there's a nice segue. Kevin's informed me that there's now over 80 people in logged in. So that's a mix between some family stakeholders, guardians, close circle of connected people, and some of our staff as well. But so just going to get into some of the ones that were sent to us in advance. If any more are coming, if you have any, feel free to type them in, and Kevin who is manning this operation, will assist us with that. So questions like, is it possible to get pet care packages to our loved ones, food, toys, etc.? A college student kind of care package. I'd say so. I did the exact same thing for my mother. Some of the stuff she needed, she likes these little tulips that were made out of chocolate. She likes chocolate. So
can I interject one thing? Yes, actually, we encouraged it, and hopefully, when you were communicated to yesterday about not taking your son or daughter home, I know that I saw some information that was passed on to me about one house, different parents getting together and taking sort of different days or different, identifying what they're bringing in, so that, one group, it was they wanted to buy a meal for everyone for Friday, and so they made plans for lunch for Friday for that group. So
that is so nice.
So so certainly, yes, we encourage it. As I told the managers and directors, and if the individual will have a behavior or have a hard time seeing their parent and not being able to communicate and have them in, then certainly try to make sure you're really planning ahead for that, so that you're not seen out the window dropping something off, or where we can't allow you to come in. But yes, the care packages would be greatly appreciated.
Mm-hmm. The same person asked about foot and nail care. Somebody that's prone to ingrown toenail. That's something we'll talk to Sharon about. But
So our plan with that is, again, we have 7 nurses that are full-time and then some part-time ones. And so the plan would be to just make sure we're communicating that to their doctors, whether it be a podiatrist or whatever the care is, or, talking with the guardian, letting them know that they would be doing it. Our staff are not allowed to do that. That is not part of something that they can do.
Trust me, you don't. Yeah.
Yeah, but a nurse is able to do that.
And the third one on this particular request, it asks about group home staff updates using Navigating Life at least 2 times a week. Now, I will talk a little bit about Navigating Life. Navigating Life should be used daily and with frequency daily.
Yep.
And this is, I think this is going to give us an opportunity to look internally and find out what some of the hiccups are in our own services. Navigating Life, for those of you who don't know, is our own, is an app that we built that allows for, the sharing of pictures and video and communicating in a social platform. For small groups of people, usually the groups that are living together in the same house. We are getting approached by outside organizations looking to demonstrating great interest in this now and wanting to purchase a license for it because of the COVID-19 coronavirus. When you can't see, I wish my mother's assisted living had Navigating Life, because I wouldn't mind getting a picture of her a few times a day just to see how she's doing and to see if she looks happy. So that is something that we own, and we should be fully implementing that, and that should happen throughout the day, and hopefully that will give our families that are using that some peace of mind. And if there are families out there that have not yet taken the step of downloading the app or learning how to use it, this is probably going to be a good time to do it, because we for as challenging as all this is, and as much as none of us invited this or wanted this to be dealing with this right now, crises can provide opportunities for growth and to sometimes discover things that you maybe were to. We're doing this virtual meeting right now. We would have been doing this if it were for this. And it may be that there's more virtual opportunities that we need to embrace as an organization that talks about wanting to use the most innovative practices in accordance with our mission and values. So I think that if there are families that aren't using it, that don't know how, we're going to get you the resources, and maybe this is just the time that we're going to all become fluent in using Navigating Life to communicate.
Yeah, and just so, if you aren't using it and you don't know where to start or how to get started, certainly let your manager know, or your director, Doreen and Michelle, know, because we do have people that can help you, walk you through that process and really get you onboarded to that. Tiana McGee has a team of people. Usually it's just her, but right now she's going to have a couple of resources to be able to respond to the demand. Because what our expectation is, and came out of the meeting that we had yesterday, was that we're going to put a minimum expectation of pictures by each group at each house, at each location, day shift and 3 to 11s, and then we're also going to enhance the schedules that are in Navigating Life so that you'll be able to see some of the activities that they're going to be participating in. And if we do make some YouTube available, or we stream some Facebook Live and some other things, that we will certainly build in letting you guys know that that's happening too. So if you wanted to join and see the activity, or at least you could engage with them later about that activity when you do call or FaceTime with them, or and see the updates. So I encourage that. I know a lot of
You said a minimum expectation. Did you have an amount?
Well, what we talked about yesterday was 5. We talked about 5 for the day service time, and 5 for the 3 to 11 shift. We're still working on that number. There was some discussions where I hate putting in a minimum, because then some people will do a minimum. But I'd rather put in a minimum and work with those people who are only doing 5. And so I'm not sure if we're settling on 5 or 7, but it was more than 3. Mm-hmm. So.
And for families that are using this product, you probably know this already, but if you're just new to it, or you're going to be using it more during this time, family dynamic or family response, if you like a picture, if you like a post, or you write back, and that means so much to the staff. I know it creates this sort of economy that I give to you, you give to me, and it's been more successful in programs where families are a bit more active.
Yeah, and the conversation I had yesterday with a family member is who isn't that familiar with it and doesn't feel that comfortable with technology. They FaceTime their son, and this person uses Facebook, And I can tell you, if you can FaceTime and you can use Facebook, this
You could do
is
this.
just as easy as that. And the key to, she said, the question was, well, how is it going to enhance any more than FaceTime is, because you can just take a little video of yourself or a little picture and upload it to your private feed at any time, so that then, you know, your son and daughter would be able to see that. And so there's really some good opportunities, and, you know, the schedule was part of the conversation that led to us talking about those other things. But yeah, we will be enhancing that.
And Dan and I worked in this field a long time, but we know that if you want something to be sustained and something to be continued, you know, and followed, you have to have systems for that. And you know, when there's exceptional things like, you know, if you're relying on a staff person to set your child up with to FaceTime, you know, during this time of uncertainty and schedules, you know, some of them are a mess and we're trying to figure things out. I'm afraid that some of those special arrangements get lost, but if we can say, look, we'll promise you that we're going to be posting at least 5 times through the course of a shift pictures of, it may not be all including your child, but, you know, we'll try to be fair about it. Then you know you can count on that. That's something, that's some touchstone. And then if the extra comes along and we can get to that on top of that, we're going to try. But this is creating a minimal standard for us that you've got to know what's going on. You want to see your kids. You can't go weeks without knowing what's happening. And I realize how frustrating it must be when maybe you're not sure who to talk to when you call, and it seems like somebody different answers every time. It must be very frustrating. But we're working hard to try to create the kind of consistency and continuity that you can expect, and that all of it's going to be designed, you know, first and fundamentally to thinking about safety standards. All right. I think we already talked about. There was an interesting question that came from the mother of a person that is now has her child at home with her, and she was speaking to some of the things I think Dan mentioned. I'd love to hear him talk a little bit more about it, but wanting to know whether or not she could replicate. And this just touches me because I just imagine how challenging it's got to be for some people. You know, if you've got your kids at home now during the day and before they've come to NuPath, and they probably miss their friends and their routines, and you probably miss your friends and routines, and so it's got to be crushing in some regard. But this mother wants to know if she can replicate as much of the programming at home, wondering whether or not there's a video of her child doing morning meetings, you know, going through some of the things, the schedules, the tools that she uses on a daily basis here at NuPath. And to that mother who wrote that question, you're a special lady. I mean, we've got a lot of special mothers and fathers and people connected with kids here, and I know that everybody's trying to do their best to serve their children. And if you've got them at home, it was part of my original dream. When we made the decision to close our congregate care settings, we still are trying to encourage our staff to come in, as Dan Lannon said, and using them to deploy them in our residential sites. But my hope is that there will be enough staff remaining that we may be able to think about using them in some different kinds of creative ways. Dan's already talked about the YouTube channels and doing some of that. That's the first I heard, so I'm really thrilled to be hearing about that. But would there be, you know, staff that could we do one of these sort of video conferences, you know, do a call-in with somebody familiar with your child that you know, they could do it, maybe 5 or 6 people could call in and do a small group meeting online. I'm not promising anything, but where my mindset is what kinds of opportunities are there out there that we haven't before availed ourselves of, and sometimes, you know, it's necessity is invention, is a mother of invention, or whatever that expression is, that I believe this is going to compel us to you know, put into action some things that have been, you know, more at the conceptual stage, and using tools in a way. We wouldn't be doing this right now if it weren't for COVID-19 and our own wonderful Kevin Tucker's at the end of the table. You can't see him helping us with the technology for this. I had a board meeting last night. We did it virtually, and it's not my preference because I'm sitting here with basically an empty room. Dan Lana and I, who I see every day, and talking to, you know, maybe approaching 100 people now that I can't see you, and I don't know how you're responding to this, or how you're in, and it's just not. I'm an organic person that I like to see people's faces, but this is you know, sort of habituating us to new kinds of experiences, and some of it is just our own fear. It's my fear. It's my desire to be connected, physically, when we're living in a world that more and more is virtually connected, and we have to be able to do that. So, Dan, could you speak to maybe some things that you already kind of talked about the YouTube channel? Are there 3 people that are going to be sort of coordinating some of that, or?
So as we have it sent, and there was a number of ideas and a number of suggestions, and I wanted to get the different programs and different day service programs to share some of the regular routine things that happen with their day programs with the residential component, so that we can try to mimic those at the residential component. And then from that came a conversation about, doing some Facebook Live morning meeting or things like that to just, to create a different atmosphere, to create a different, to see some of the familiar staff that they might not be seeing. And so there's 3 people, Kristen, Marianne Fitzgerald, and Brian. They're going to be the hub of that information. We are going to make that available on 365, which staff and managers and directors should be able to access anywhere. But we're also going to try to build what speech therapists and occupational therapists build is activity boxes, so that that if the supplies aren't prevalent at the house, that we can send that activity box out to the house, and they'll have everything they need to run these activities. It happens so much better when someone knows how to run that activity, and so that's what we're trying to use some of the day staff to run and do those activities, and just try to enhance some of the cooking groups and the exercise routines that we have, and karaoke. Someone had an idea for karaoke, which I can't even imagine how they're going to pull that off, but they had an idea to do karaoke, so they're sort of trying to put that all together for them today. As far as a morning meeting, there's been a lot of discussion about the morning meeting board and how we can do a morning meeting, and a speech therapist last night emailed me an idea that she put together to help enhance that. And so we are working on all those things right now. Again, I honestly, at no point did we want to say that all of this stuff is not a priority, but for the last couple of days, our priority has been making sure supplies have been there. Staff, we have the ability to screen everybody that's coming on shift, that we have the supplies needed to sustain this for a little while and cover staffing. So now our focus has shifted as of yesterday to really enhancing programs and activities.
And Dan, you mentioned Mary Lou, the speech language pathologist. So one of the things she's I don't want to give her credit for, she should probably draw them, but been coordinating is a way to talk about what is going on for our people. And anxiety manifests in so many different ways. When I get anxious, I can't sleep. Different people, and it affects all of us. And so we have to be sensitive to that. We have to find many ways to provide outlets for and to provide information. And so maybe we ask her to do something that can be saved as a YouTube video that people can watch at their leisure, where we're trying to help people understand why can't I go to my day program? Why can't I go to work? Why can't I see my friends? And questions that people may be having in their respective in your homes and caring for your children if they're stuck at home during the day. One time I thought it'd be great to have staff that could maybe come and stop by some people's homes and take their kid out for something to eat or something. But even that it feels like more and more socially we're being asked to not. The restaurants aren't even open, so being limited to just doing things that are in open spaces and free, but going for walks can be a great thing. Did you have something to say about that, Dan? And there's a couple more questions.
No, I was just going to say that we'll be following up with more information on that.
And for the mother that wrote about whether or not she should get pictures for her child to use at home, I'm going to follow up on that for you, and if there's a way to do that for you.
Yeah, it certainly seems like we should be able to do that through Navigating Life, and so that's what some of the things. And again, I would just reach out to. Well, we have the question now, so we'll get it in the right hands to help you address that.
So I'm trying to any government funding available for our payroll. And how long will we be closed? I'm reading, what resources can you provide parents and families regarding the latest DPH and DDS guidelines for contacts with their loved ones? I'm amazed that I can see this. My eye doctor would be thrilled, and I may have missed part of it. Well, let me address the first one. So the DDS and the guidelines for DDS, many of them that we're following, can be found at mass.gov in a number of places, because much of this guidance for companies like NuPath is coming out in duplicate, triplicate, and it's across many of the service organizations, because even though we provide 24-hour care at NuPath, but many other organizations do that for very different populations, but mostly the rules apply across the board. So what government funding will be available? So what we're hoping will happen, and we're waiting to I hope by the end of the week we'll have some answers. We have, the way it works for us is that we have contracts that people are assigned to based upon what services that we're to be providing. So we have some people that are working, and they're in a 3168 contract code that is around employment and preparing for employment. Other people may be in something called 3163, which is community-based day supports. Do I still have that right, Dan?
Yeah.
Those codes, ingrained by buying. And among those, there's other breakdowns of what kinds of services would be provided. So the way it works with the state system is that money is put into these contracts, and then we access that money as we go through the year by billing according to people's attendance and according to our ability to provide that service. Now, when we're not providing any services, we can't do any billing, and if we don't do any billing, we don't get paid from the state. But that money is still in our contract. So right now, the easiest thing that the department can do is to determine a set of guidelines, which they're working on right now, that will guide the submission of bills and attendance data to the state, where we would be able to access the money that, had we been open and had we been continuing to provide these services, this would be the amount of money that we would have been expected to be able to recoup and reimburse us. And our budgets, frankly, are built on that kind of expectation and sort of utilization predictions, which is what we look at. So that was, if that comes true, that would be a big help. It's not 100% cut and dry on that, because we also get some of our revenue from Mass Health and Medicaid for our day habilitation programs, and they operate under a federal standard. So we're advocating to be able to do something similar from Mass Health for our day habilitation programs. One of the things that you may have heard in the news is this discussion around how staff who are not able to go to work because of a closure, because they're at home, sort of self-quarantine, would they be eligible for unemployment? And I've had that put to me as being a great solution, and why does NuPath do this? Well, aside from the fact that we still need to maintain a skilled and well-trained and healthy core group of staff to provide these services, that everybody can't be gone, or we wouldn't be able to do anything for folks. We, as many organizations like us, are self-insured for unemployment. That means that rather than paying into the state unemployment insurance, which many large organizations do, we choose to be self-insured, which means that if somebody is eligible for unemployment, that they've been an employee of ours, we pay them off of our regular, operating budget, just as if they were on salary, for the number of weeks that the federal government tells us that the person is eligible. The reason we do that is because we are employing, 30,000 people and laying off 10,000 people, because we've, moved a plant to, into some international environment. That's not our business model, generally speaking. And so we're very careful about, I don't remember the last time we ever laid anybody off, although that could happen if we're, things don't improve here, but that's not been our business model, that's not been our experience, so it's always been in our best interest to just pay in those rare cases where people are eligible for unemployment. So that isn't really a solution for us because it's just like continuing to pay people off our payroll. How long are we going to be closed? This question asked. We don't know. We've said that. We hope that it won't be, the date I've been recently hearing is April 7th. Is that a date that's been flying around? Not for us, but for schools. And I'm just really looking at what other people in the community are doing.
Yeah, so that's a date that obviously a lot of us heard. Charlie Baker announced that on Sunday. He originally announced April 17th, and then later it was corrected to April 7th. We have not got that communication from Executive Office of Health and Human Services or DDS. They won't commit to that date as far as us being given the okay to return to business as usual. And so I think it's a fluid situation. We had 11 calls this week, webinars, different information, Executive Office of Health and Human Services, DDS, provider groups, and so we would just continue to try to keep everyone as up to date about the specific information that is directly affects our field. Someone had asked where can they go for more guidance, and you mentioned the mass.gov COVID-19 website. They have a specific website out there. You can go down on that. You can see where our programs fall under and those regs. And I can tell you that
congregate care settings is what we fall under.
In rehabilitation, and those continue to evolve and change. I would say every 48 hours, and so they might not be as up to date as what they have told us through a conference call, but usually what we've seen is it's been within 48 hours that gets posted live. Mm-hmm. Also, someone else mentioned a question about I forget, it was on the top of my mind. Well, we'll come back to it. Let me read it over.
Yeah, so this one up here was asking, I'm kind of smiling myself because these are the same questions I asked Benchmark, where my mother lives. But, her first question is, how soon will people in the residential programs be able to get out to the community? Today, this afternoon. I mean, as long as they're not going into spaces where lots of people are around, and as long as we have adequate staffing, people should be going for walks, they could be going to parks, they could be going, run trails. I don't want to if Dan's saying something different to people, but I mean, it's my understanding that people are not going to be, prevented from getting outside. Something, Dan, how long is this going to take? My read on this, and this is just me, trying to get information every source I can. When we hear about more testing, community testing, being made available to a wider berth of people. But right now, the tests are so limited that they're being restricted to just a few people that maybe are showing very specific signs. But once we get, these drive-through centers that we've seen in South Korea and other places, I think that we just don't know if we have thousands and thousands of people. I mean, are half the people at NuPath, have they been infected? We just don't know it yet, or has nobody been? And those are big swings, and so I'm just waiting to hear that we're hearing little bits that more and more testing is happening in some different lab sites, but it's still being pretty much I think it's being very specific and selective as the people that are getting tested if they truly have got the symptoms. So that with that said, to finish up with this person's question, I asked if I could have my temperature taken. If it was normal, could I enter? And then I understand why a mother would want that. And again, I'm going to just say to you what was said to me, and I think we all agree intellectually that we want to protect the well-being of people. And the best thing right now is to be pretty strict and not letting lots of exceptions be made because those are when I'm afraid we were going to somebody will slip through, and then all this work that we're doing will be for naught if everybody in the home still ends up getting sick. We just don't want that. We're just trying to keep our environments free and cleared. Do you have something to say?
Well, I was just going to sort of field one of the questions. I'm trying to just make the ones that I think think fall under the category of things we've answered, like where we can get more guidance, who can get this from DPH and DDS, all those, trying to sort of skim through some of those. But there was a question, can their son or daughter get the same health checks that we're giving to staff as they come in? Yes, definitely, that is happening at the houses. They are getting the same temperature checks and health checks that the staff are getting. Also, as far as, individuals understanding why they're not able to see their loved ones, we know that that's a struggle right now, and that's why we're really, really hoping to ramp up the navigating life and the use through that, so that you are able to not only FaceTime them or call them at the time you are available, but you can post little pictures and clips of things they like, or pictures of your family and activities that they would be doing, and the explaining the virus and why a lot of this is going on is what the speech therapist focused on, and putting her activity together. And so we're trying to educate them as much as possible. I know that there was a question about, if you're out on an activity for a walk in the park or some location, can we go there and participate in that activity and be out in the park with them? If you don't think it will create a behavior for your son or daughter, and you're keeping social distances, which is the 6 feet, then we would say yes. I think what DDS is really trying to DDS and the Executive Office of Health and Human Services is control, is that if there is an outbreak in one of our residential programs or with staff, that we are able to trace back the people that they have been in contact with, or the source of the thing. And so we're really trying our best to that was why, even before it was asked of us, that's why using our own staff and having our own staff cover these shifts has been really our primary focus.
Mm-hmm. So another question: if a client's diagnosed with the virus, where would they be quarantined? We talked about this a little bit earlier. This is a challenge for folks. I don't know if we haven't quite determined. Some of it's going to be determined if we end up with 20 people that are ill or one. Some agencies, the way they're tackling it is, as I said before, they'll clear a house and make that the home to convalesce, and then people are moved around. I see problems with that. I think it's a major inconvenience to the people that are healthy, having to be made to move from their home. So that's a problem. The other option would be if we were to consider using the Martin Center, one of our day programs, to set up some sort of a specially equipped space. We'd have to bring in cots and that sort of thing. In any situation, if somebody is diagnosed with the virus, it's going to be our responsibility to provide, the highest trained staff and people that are well versed in infectious disease, and that would be something that Sharon Pitts would coordinate with her nursing team, and we've got some very highly skilled and very professional staff working in our programs. We have several medical models, and so we have staff that are more clinically focused, and so it might be that we would, for those programs where somebody's ill, have a higher level of credentialed staff. I'm not saying that's exactly what we'll do, but some of it will be based upon how many and what is the sort of the threshold of moving people out. We've got 2 minutes left on this call. I'm just wanted to say, I don't know if we're...
Yeah, can I interject 2 things that came in
via
text, just important to what we talked about? Yes, clarification on if a person needs fingernails or toenails care and clip. The nurse could provide that care once we got approval from the doctor, so I'm not sure if I was clear with that. A question had come in. I just wanted to make that clear. The second is that either we just have done, or we are in the process right now. Greg Morris is setting up with his team a webinar for navigating life, an introduction to navigating life, and a how-to. And so he'll be. You can stay tuned for that. People will be getting information on that, and that will have the people that are really well versed in training people and setting people up and getting people rolling with that. And so stay tuned for that information.
So just in another minute or so that's remaining, I want to just once again reiterate to you that we're I'm just a regular dude here. We're just trying to figure this out with all of you. Many of us have families. We've got our own concerns, our own crises, things that are happening in our lives, and so we get it. We know that it is. To walk in a store like Stop and Shop and find the shelves just like ripped bare, it just feels like we're in a whole different sort of cultural context that anything that many of us have experienced before. So this is a stressful time, and we intend to continue to meet each and every challenge as it comes our way. We are not going to get everything right the first time, but we want to do the very best that we can, and we want to answer and to provide the kind of service that you expect from us. So continue to communicate, continue to ask questions. We are going to be sending out a survey to those people that have registered that we have emails for. It should just take a couple of minutes because we're trying to think about some sustainability over the next few weeks as long as this lasts. And who knows, maybe it'll be something that goes into the future. But having at least one of these family virtual forums a week, or if people felt that more than one was necessary, we could consider two. But if people are feeling like this isn't necessary, we all have other things we do with their time. So if this has been helpful to you, if you think that you'd like to continue this, we wanna do what's working for people. And if there's a better way that we could think about getting you the information, I just want to make sure that you guys feel that you have a place where you're getting, firsthand, the very best information that we have, unfiltered, and try to just let you know it all. We'll get it out there and try to figure this out together. Because at the end of the day, we all want the same things, and we want everybody to be healthy and well and safe and as comfortable as possible, and just to get this damn thing behind us. So take a minute to fill out that survey when you get it, and know that we'll be trying to schedule something for next week and then going forward.
And if we didn't get to your question, or if you feel like you still need us more clarification on the questions, because they did come in, there were a lot of them, and we tried to group them together. Certainly, reach out residentially wise to Doreen and Michelle. Those are the two directors, as well as the manager can help you get that information to them so that we can specifically answer your direct question. And certainly feel free to reach out to me if needed. And so, but what we're really going to try to do is continue to provide information as we get it, and try to really make it specific into how that affects what our next decision is. And just one thing on the question of what our plan is if someone does come down with it, and the closure of one house and moving people around and everything. I think there's been a number of discussions from the Executive Office of Health and Human Services as well as DDS, and so they know sort of different agencies have different preliminary plans, and we've heard some good feedback about our plan if we needed to invoke it, and so I thought I'd mention that.
So thank you all for your time, for your participation. If you didn't care, you wouldn't be logged on right now, and you wouldn't want to know. Thank you to our incredible staff, residential heroes everywhere in this organization that are coming in every day and trying to figure this thing out for all of us. So thanks, guys. Stay tuned. More later. Bye. Be safe. Wash your hands.
Thank you.